CF and pregnancy. What is genetic carrier screening? Imagine planning a family and wanting to understand every step you can take to ensure a healthy future. Genetic carrier screening for cystic fibrosis is one of those important steps. It is a test done before or during pregnancy to see if someone carries a gene mutation that could cause cystic fibrosis. Cystic fibrosis is a genetic condition caused by changes in the CFTR gene. To have cystic fibrosis, a person needs to inherit two faulty copies of this gene, one from each parent. If someone has only one mutated gene, they are called a carrier. Carriers do not have cystic fibrosis themselves but can pass the mutation to their children. The screening usually tests for the most common CF gene mutations, often around 23 different variants. It is offered to people planning pregnancy or already pregnant. If a person tests positive as a carrier, their partner is then tested to see if they also carry a mutation. When both partners are carriers, there is a specific chance for their baby. Each pregnancy has a 25% chance that the child will have cystic fibrosis, inheriting two mutated genes. There is a 50% chance the child will be a carrier, inheriting one mutated gene, and a 25% chance the child will inherit no mutations and be unaffected. If both parents are carriers, doctors can recommend prenatal diagnostic tests to check if the fetus has inherited cystic fibrosis. These tests include chorionic villus sampling, which is done between 10 and 14 weeks of pregnancy, and amniocentesis, performed between 16 and 20 weeks. These tests analyze fetal DNA for CF mutations but cannot predict how severe the symptoms might be if the baby has cystic fibrosis. There are also newer methods called non-invasive prenatal tests. These use a blood sample from the mother to analyze fetal DNA early in pregnancy. They do not requiring invasive procedures or testing the partner's DNA. However, these methods are still being studied and are not yet widely used in all clinics. Understanding carrier screening is very important for couples who want to plan their families carefully. It helps them know their risks and make informed choices about pregnancy and health care. Consulting with a genetic counselor can provide personalized guidance, explain what the results mean, and discuss options like further testing or reproductive choices. For people living with cystic fibrosis, knowing about carrier screening can be part of managing life's transitions, especially around pregnancy and family planning. It allows individuals and couples to be proactive, seek support, and make decisions that align with their health and values. Remember, every person's situation is unique, and medical advice from healthcare professionals is essential to navigate these choices safely and confidently. In summary, genetic carrier screening for cystic fibrosis is a valuable tool that helps identify carriers of CF gene mutations. It provides crucial information to assess the risk of passing cystic fibrosis to children, supporting early diagnosis and empowering families to make informed reproductive decisions. Always talk to a healthcare provider or genetic counselor to understand what screening involves and what options are best for your specific circumstances.